Alright guys, this is Health Nibble number 81, and I know it's a late one, but anyway, getting it in. So tonight we're talking about diabetes and fructose. So, you know, if you see on pretty much every processed food, they're going to have something about corn syrup, which is fructose. Your sodas are full of fructose. Your sport drinks are full of fructose. And so what I want you to understand is there's a difference between fructose and glucose, and sucrose. So like table sugar, the white stuff, you know, that definitely is a huge contributor to diabetes. And table sugar is sucrose. So that's half glucose and half fructose. So the difference is between fructose and glucose is fructose can only be metabolized by the liver. And so it'll package it up and turn it into fat, but you know, it can't be metabolized by the other cells. Where, on the other hand, glucose can be metabolized by all the cells. So, for instance, if I have eat some rice, that's all glucose. It's not a processed food. Now you know it's refined rice, so it's carbohydrate, but it's glucose. So all 170 or 175 pounds of my body can use that glucose. But if I drink a soda, it's only my liver can metabolize that. So what happens is it metabolizes it, and then once your stores are filled up in your muscles, so your glucose stores in your muscles, then it just starts backing up in the liver. And so that's when you get fatty liver, and then you get a fatty pancreas, and you get diabetes. So I'll give you an example of how devastating this is in terms of disease. So, and you know that diabetes leads to cancer and heart disease and, you know, everything else under the sun, dementia, Alzheimer's. So when you look at China, like in the 1980s, around 1980, they had 1% of their population was diabetic. And they had a huge diet in Asia. They have a huge diet of rice, and it's white rice. So, you know, in our culture, we try and low carb everything and think that all carbs are the same, but really they're not. You know, fructose is way worse than glucose because it can only be processed by the liver. So, so in modern times, so in 1980 they had 1% of their population was diabetic, type 2 diabetic. Now it's 11%. So in a short period of time, they've increased their rates by 11 times. And what they've done is, you know, all of a sudden became like Americans. Everything, they're eating highly processed foods and just all the trash that we eat and all the fructose. And they have fatty livers and they're diabetic and all of that stuff. So anyway, you know, the point is keep in mind when you're taking carbohydrates in that they're not all the same. So, you know, now we have kids. It used to be that all kids were diabetic were type 1 diabetic. So, you know, they had the pancreas didn't work. And now half the kids are type 2 diabetic. And so now we have kids that have fatty livers, and that's well documented. And it's because they walk around drinking sodas and sporty drinks, and parents unfortunately think that like they're drinking a Gatorade, it's healthy. And it's not. It's full of fructose. And in fact, it's metabolized by the liver just like alcohol. So you'll end up getting that's called non-alcoholic fatty liver disease. But you get a fatty liver just the same that you would as an alcoholic. You know, if they're sucking down a few sodas a day, it's like, you know, an adult. I mean, if you look at the size of an adult, it's like an adult drinking lots of beers in a day or whatever, or lots of drinks. So, so anyway, you know, hang on here, I gotta get over it. So fructose is a much bigger driver of diabetes. So I think there's a wreck up here, so I'm gonna get off, but that's the point of the day.